Hey, Dr. Chris here, talking to you today about carpal tunnel syndrome. Carpal tunnel is an often misdiagnosed condition that can lead to unnecessary surgery. So my goal today is to give you some alternative options to avoid you from going down that path. Roughly about 250,000 Americans per year have the surgery at a cost of roughly $5,000 to $10,000. What research shows is full restoration after the procedure is only at 60%, and customer satisfaction or patient satisfaction after the procedure is only rated at 60% as well. So not very high standards for that procedure, actually very low on the surgical spectrum. So one of the other reasons why we want to keep you away from that procedure if possible. It's also common to have some permanent loss in grip strength post-procedure as well, which a lot of folks don't know about. So first I'll talk about symptoms. How would you recognize it if it was coming along? Numbness and tingling in the hand is one of the most common ones. Carpal tunnel is compression of a nerve in your hand or in your arm, and that can produce the sensation into the fingers, into the hand themselves. You can have inability or difficulty with fine motor activities and loss of strength in the affected hand, and it's usually your dominant hand that gets affected first. The patients that I see it most commonly in are hairstylists and construction workers, as well as teachers or patients who are working at the desk from a day-to-day basis, especially in construction workers when they're using equipment that vibrates over time. That vibration can cause that impulse, that entrapment of the nerve. Other causes, those were the symptoms. Other causes can be inflammation within the body, specifically within the arm itself. Inflammation can shorten the muscles in the forearms, and that can compress your nerves. Poor sleep is another one. If you sleep with your arm flexed or extended, that can stretch the nerve out. Vitamin deficiencies, arthritis, rheumatoid arthritis is linked to this. Shoulder, arm, or neck ailments, pregnancy due to the increase of fluid in your body, work-related stress, which I'll touch on here in a minute, as well as diabetes and hypothyroidism, to name a few. So those are some of the outlying causes. So now let's talk about treatment alternatives for you to avoid it. Treatment options. First thing, splinting. Splinting is a very cheap alternative. It's a night splint. It's a splint you wear at night. It has a metal rod that goes, it's over a sleeve, and the metal rod goes down into the forearm so you can't flex your wrist. Very, very good research with that, and that's a good cheap alternative for it. Also, vitamin B6. I put patients on vitamin B6 all the time with numbness and tingling issues in their arms. Great research out there with vitamin B6 and carpal tunnel syndrome. Other things you can do: hand strengthening and stretching exercises. Acupuncture has been shown to be effective. Physical therapy for hand strengthening and stretching exercises if you do not know what to do along that realm, and as well as chiropractic adjustments. With carpal tunnel being misdiagnosed, the entrapment of the nerve can actually be coming from the shoulder, the elbow, or the neck. So anytime that nerve is impinged, what chiropractic does through the adjustments is release that tension, allowing that nerve to function better. So another good alternative for you is to have those areas of your body checked as well. Last but not least, if you're at a computer station, you have to fix your computer station to make sure it's ergonomically correct. You want to make sure everything is at 90 degrees, from your elbows to your hips to the way you're sitting down to the knees. You want to be at 90 degrees, staring straight at your computer. You stick your arm straight out. That's where the monitor should be at, roughly, and then your line of sight should be in the top third of the monitor. So you can take that change as well, make the necessary changes to your workstation, take breaks. That keeps you nice and loose. Hope this was a great tip for you. As always, look forward to talking to you next time. Talk to you soon.